Thank you very much, Nick. Indeed, I hope I can. Although I'm afraid it didn't come with any money. I just want to make sure everybody understands. Usually people ask me that straight after it. I'm here today to launch NHS England's call to action for improving eye health and reducing sight loss. There is no better place to launch this than here today, with so many of you here interested in this particular area and many of you affected by it. And it's your voice that we need to hear. And let me be clear, it is your voice, not ours, which will define the services of the future. If NHS England as commissioners are meant to change things so that it's comfortable for the people who are afflicted by such conditions, we must make sure that it's you that is at the centre of this. I will hold myself to that, and I will also hold NHS England to that. You're at an important crossroads, it would seem to me, here in where you go with the issue around good sight and maintaining that sight. NHS England has used the call to actions to highlight certain areas where we feel that a massive change is required. So David Nicholson, when he was the Chief Executive last year in July, launched the first one, which was a much more general one, looking at how we were going to alter the services, both elective and acute in this country. We then nuanced that to look at general practice and primary care, in particular pharmacy as the third one. And the number of ideas we've had coming back to us to develop that strategy is profound and of great importance. However, this is the first one where we've looked at a particular organ, a particular sensory organ. And I think that should give you some heart that NHS England is on your side on this, trying to get an improved service. Having just listened to Thierry, who was an inspirational young lady, and one who has a great life ahead of her, there are probably thousands of people like Thierry who I do not know in this country, could never know. But with representatives like that, we will know about them, and we will make sure that the services are attuned to what they require. And that goes beyond just medicine, because the consequences of low sight or loss of sight affect society profoundly, not just for the individual, tragic as that may be for them, but for society in general. The economic cost of allowing sightedness not to improve, to maintain or improve, is profound as well. We are here to try and reduce the burden and to improve the services for those who suffer from the burden. And I hope that our call to action and your ideas will help galvanise us into doing that more effectively. Over the past 18 months in this role, I've discovered that most things in this world revolve around institutions and not around people. Care for eye disease is often thought of at the ophthalmic department in the acute general hospital and the tertiary centre. We live in a new age of medicine, where much more can be done closer to the person's home or their society or their workplace. And we must look at ways that we deliver that care more effectively in the community. About 18 months ago, I went to my optician just for a routine eye test. I think community opticians do an incredible job, and that day I discovered why. Everybody dreads being told that they've got a bit of their sight going. And just to my left lower quadrant there, I discovered mine had. Now, I always thought I was just a bit clumsy and was knocking the wine glass over, probably because I'd had a third glass rather than a second. But actually, it was more than that. It was actually I couldn't see there, and I didn't know that. And my community optician picked this up, and of course, with a doctor's brain, I'm immediately having a CT scan and MRI scan, having a surgeon's knife within a few weeks, aren't I? And then I was referred up to Edinburgh, as it was, because I lived not that far away from there. The optician had been so nice, he sat me down and told me what this would be. And in fact, he was quite embarrassed, telling a doctor that you didn't know you had a appointment open. Why didn't you know that? Did you not do your own visual field something? So I went up to the hospital, and this rather, a man probably a similar age to me came in with a dicky bow tie and one of the torches on his head. He said, "Sit down." I said, "Pardon me?" He said, "Sit down, I'm just going to shine this light in your eye. I'm going to look in the back of your eye." I said, "My name's Mike Berwick, I don't know yours." And I think we have to get to the heart of this. If that's how they treat me, I don't know what they do to people with this. And we have to make it much more patient-centred. Luckily, he was a brilliant ophthalmologist and told me I didn't need a CT scan and MRI scan. I was born this way, and that's just tough. And I get on with my life, and I didn't lose my driving licence, which was the only thing that really concerned me. So I think coming to his point about what it affects you, I think people don't understand the profound psychological effects that loss of function delivers. And I was frightened by that, so goodness knows how you all cope, who have an established loss of sight. or indeed partial loss of sight. So I'm here today. I could quote loads of figures. I'm making a great big list of figures, but you all know our population is getting older, the demands on the services are going to get more. Diabetics, 30% of us are now pre-diabetic, we read the other day. And we know that the predisposition to losing sight has never been higher, but we live in a wonderful society. We're aging because we're aging well generally. People are living longer and enjoying life more, and we must preserve their sight so they can enjoy that life even more. Now, I've got the website up on here for you to put your ideas to, but we'll circulate where I would like this information to go. And I don't mind getting personal emails on this, but please not 2,000. My email is mike.berwick@nhs.net, which is dead easy. But if some of the major charities that are here want me to channel this, I will. And I will make sure that any of the ideas you come forward for transforming our services to be much more patient-centred will be taken forward. Thank you very much for your attention and enjoy your conference.